Hi doctors, Focus 30 Day 14. Yeah, we are approaching NEET PG exam. Just 2 weeks are remaining for. Exactly 14 days are remaining for NEET PG exam. So these 14 days are very important. So however, how much you prepare in this 14 day, how much you revise, how much you do PYQ, this will reflect in your exam result. So all the best. Don't kid. Put your 100% and go forward. So today also I come up with some important topics. You can see disability indicators, very important. You can see here decorticate posturing, decorticate rigidity, decerebrate rigidity. Simple question. You can see the nucleus, hypothalamic nucleus. You can see the pituitary gland here. You can see the supraoptic nuclei. So these are important. The function of hypothalamic nuclei. Direct question. Disability indicators. They are regularly asking this question from these topics. Okay. Hypothalamic nuclei rigidity, leukocyte function defect. You can see LAD, leukocyte adhesion defect 1, 2, 3. Definitely they can ask this question. There will be a history clincher and there is that question will come. If it comes, you are going to score that. Alcohol withdrawal. So without alcohol withdrawal, there is no NEET PG exam. This year also one question will come from alcohol withdrawal. So this is very important topics. Please revise your material. Maximum revision you do the PYQs and watch this module whenever you are free, you are little tired. Watch this, make the notes. And now I had provided the Google Drive link in my bio, so you can see the YouTube bio and you can go to the link and you can get the PDFs also. So first we'll start with the disability indicators. These are very important. We have DALI, QALY and Haley. So DALI, QALY, Haley. So nothing but in the name only it will be there. Disability adjusted life years. These are the disability adjusted life years. Okay. QALY, quality adjusted life years. Haley, health adjusted life expectancy. So this is very important. Okay. So I will say a person born, a baby born, okay, and he reached 50 year, then 70 year he died. Okay. In the 50 year, okay, he got some RTA accident and his limb is the left lower limb amputated. Okay. So what happened? Left lower limb amputated. Okay. So this much happened for him. Okay. On the 60 year, we applied a prosthesis and he lived with the prosthesis till 70 years. Okay. So this prosthesis, because of the prosthesis, his quality of the life improved. Okay. But 50 to 60 year, he was suffering the disease and he didn't apply the prosthesis. So just an example. This is an example. If a person got RT in 50, maybe immediately we put the prosthesis. Just listen here. Okay. So this is an example. Okay. Now we'll see the situation. What is disability adjusted life years? We'll see. Years lost due to premature death or years lived with disability. So, see, this is the most important measure of burden of a disease. Here, the person got disability at 50 years. He lived that with that disability. Years lived with disability almost 20 years. 20 years he lived with disability. Even though 60 years we had given some prosthesis, still he lived 20 years and he died. So years lost due to premature death, okay, or years lived with the disability adjusted life years. Okay. For example, this person he born at 50 year, he got RTA because of RTA complication, or 50 years RTA he got some head injury, and 60 year he died. 60 year he died. If this 50 year he didn't get this problem, he should have lived up to 80 year. So actually he is losing almost 20 year here because of this RTA head injury. He lost 60 year. If the disability doesn't happen, he should have lived up to 80 year. Because of the disability, he lived up to 60 year. Okay. Clear. So these are the two extremes of this example. Now I will discuss individually. Now you listen here. So years lost due to premature death. So premature death or years lived with disability, that is known as disability adjusted life years. So disability happened because of the years of living may come down, or he lived with that disability, that is known as disability adjusted life years, which is very very important. It is the measure of burden of the disease. This is the important question. Measure of burden of the disease is coming in DALI, disability adjust life years. Clear. Now we'll go to the next one. Quality adjusted life years. Quality, most important measure of effectiveness of an intervention. Here we given in prosthesis, 60 year we gave prosthesis. So here gain in quality of life years with an intervention. Because of the prosthesis or because of the intervention, any intervention, the quality of the life improved and years of the gain in quality of years happened. This is known as quality adjusted life years. So it is giving the measure of effectiveness of an intervention. This is very important. Quali means quality adjusted. So he is having some disability, we gave an intervention, so his quality of life improved. The measure of the effectiveness of an intervention is done by quali, and the quality of life years with an intervention, the gain, there will be a gain of quality of life. That is very important. Okay, clear. So that is quali. Okay, quali. And what about Haley? Health adjusted life expectancy. Health adjusted life expectancy. So equivalent number of years in full health that a newborn can expect to live based on a current rates of ill health and mortality. Haley is very simple. This is an expected life. So health adjusted life expectancy, expected life with the health adjustment. What are the health parameters which can cause the fatality, problems, issues? So with that they are calculating the life expectancy in simple word. So it is the equivalent number of years in full health that a newborn can expect to live based on the current rates of ill health and mortality. There are some ill health or mortality is happening. With that current how much full health he can go forward, that is known as the Haley. Okay, these are expected, calculating the full health period based on the current rates of ill health and the mortality. This is very important. So we discussed about DALI, we discussed about quali, we discussed Haley. So all are very important. So this is the community medicine ka regular question they are asking from this area. And one more thing here, so we have to calculate something called health indicators. This is also very important, health indicators. So what are the health indicators we should know? PQLI, HDI, MPI, GHI. Difficult. Physical quality of life index, PQLI. PQLI, we will discuss that. Okay. HDI, human developmental index. HDI is nothing but human developmental index. MPI, multi-dimensional poverty index. This is the poverty index. And global hunger index. These are the 4 health indicators. Okay, to define a community, how's the progress of the life they are going, to assess the different nations and all. Now we will see individual one. What is PQLA? PQLA, physical quality of life index. PQLA, life expectancy at 1 year, literacy rate, infant mortality rate, IMR. Okay, these are the parameters, domains in the PQLA. So we can write that PQLI is equal to PQL1. Simple. Life expectancy L1, life expectancy at 1 year, and PQL1. Okay, and literacy rate and infant mortality rate. So we can write L1, I4 IMR, I4 IMR we can write, and literacy rate and infant mortality rate and life expectancy at 1 year. This is important in PQL1, PQLI. Simple. Now if we go to life expectancy at 1 year, this is very important. Okay, don't miss this point. That's why PQL1. So in the question they will try with this point. Okay, human development index, life expectancy here, but it's at birth. What is the life expectancy? And here it is very important, mean school years and expected school years. These are the 2 things. So for development, for a country development, we need school education. So education is important. So number of schools, so human development. Okay, here along with a development of country, nothing but our GNP, gross national per capita. Okay, gross national income per capita. So this is very important. This is development, this is the human development, the country development. We have life expectancy at birth, okay, at 0, and mean school years, and our GNP, gross national per capita, our annual income from the country. So this human development index is very important for a country to analyze. Okay, very important. Clear. Now other points are very simple, not difficult. Okay, we will see the GHI, global hunger index. So hunger index, hunger, poverty, hunger, no food, nutrition deficiency, under 5 mortality rate. See, babies with poor nutritional status, they will have under 5 mortality. This is very important. So this is the very important. Undernourishment in child under 5 years, babies having fasting and stunting, inadequate food supply. So GHI, the global hunger index, measures the under 5 mortality rate because of the deficiency of the nutrition, inadequate food supply and all. So that is GHI. Okay, GHI. Clear. So important. Now we'll see the MPI. MPI nothing but multi-dimensional poverty index. It's a poverty index. So what is this? Because of the poverty, nutrition deficiency, bad health, chances of death before 18 years, high chances of death before 18 years. Number of people with less than 6 years of schooling. So less than 6 years of schooling. So imagine one person study from first standard to fourth standard, they stopped. So that is less than 6 years. That is important. Number of people with education till 8th class. So less than 6 years of schooling till 8th class. Okay, it is important. So here undernourishment, low standard of living, this also matters. Okay, so MPI nothing but poverty index, which is calculated by less than 18 years of death, and the schooling less than 6 years or till 8th standard, how much they studied, and undernourishment and low standard of living, these all are coming. So what I can say from this summary, you can see the question can come from any of these 4, but highly expected from question will come from PQLI. It is nothing but PQL1. Okay, and here literacy rate is there. Literacy rate, this is a physical quality of life index, and from the life year 1 onwards they are calculating, because they are removing the infant mortality, other deaths and all, and they are calculating from the life expectancy from the first stage. Okay, and they are calculating separately IMR. Okay, but this is less commonly used. Okay, now 1 is over. Now the important second, this is the important, this decide the country. Okay, so this is given by UNDP, United National Development Program. Okay, so HDI is very important, and you can see India is standing here. Okay, it is little bad. India is around 130 out of 190 plus countries. Okay, so HDI nothing but life expectancy at birth, L is 0, and for a human development we want school is needed, and we want per capita income, GNP. So per capita income, it's important. So these are coming in HDI. Hunger index, we can see under 5 mortality rate is the main one, because of inadequate food supply, undernourishment. Okay, and poverty index, what is it? Yeah, this is little tricky, but this is little important. Chances of death less than 18 years, school years less than 6 years of schooling, and up till 8th class, and undernourishment and low standard of living. These are coming in these health indicators. These health indicators are literally important, very important, because this question will come like this. Okay, question will come like this. Definitely the question will come like this, or they will ask from the previous boxes. So the question will be like direct single line question, like overall general indicator, overall country development, which is the overall general indicator and overall country development, nothing but IMR, infant mortality rate. Infant mortality rate is the overall general indicator and the overall country development. It is infant mortality rate. This is very important. Okay, clear. So infant mortality rate, overall general indicator, and overall the country development based on IMR. Okay, and now we have to see overall human development and economic development, nothing but our HDI, human development index, where we have what we have in that HDI: life expectancy at 0, schooling, and what was the third one? Life expectancy, school, and the gross national per capita. Okay, that is also very important. GDP, GNP. So we'll say GDP. Okay, like that. So that is important. Okay, that is very, very important. And for hunger and malnutrition, we use hunger index more than poverty index. Overall maternal care or MCH care will analysis maternal mortality rate. Maternal mortality rate is high means the maternal child and health care is poor. Maternal care is poor. That's why MMR. Okay. Overall healthcare services, and facilities, perinatal mortality rate. This is very important. This will be the potential question for this year. Overall healthcare services and facilities, perinatal mortality rate. This is very important. Okay. Okay. Now we have nothing but we have already discussed disability rate, burden of a disease, DALI. Okay, already discussed. Effectiveness of an intervention, QALY. Healthy life years of health status of a community by Haley. So these are important. This already we discussed before. Just now we discussed. So this is very important area. Especially you should know this point. IMR importance, MMR importance, perinatal mortality rate important, hunger malnutrition important, and human development and economic development, human development index. What is there in HDI? This is very important. HDI is important, PQLA is important, and growth hunger index, global hunger index. This is important. So under 5 mortality, which is very important in GHI, that is hunger index, and poverty index means there are 3 criteria, that is also very important. So PQLI is known as PQL1, life expectancy at 1 year, they will trap you there, and HDA. These are very important. And you should know DALI, QALY, and Haley. They will have simple question, simple line question, simple example. They will give a simple example. A person got accident or a person got some disease. They are done intervention. Because of the intervention, he improved this years. What is that? So intervention and improvement, it is quality. And he got this disease and he died, and he supposed to live around 70 years, but he lived at 50 years. So he lost 20 quality years. That is disability adjust life years. So these are very important. Okay, definitely they will ask question from this area. Okay, important. Now very simple, direct question, not discussing in the detail. Decerebrate posturing and decorticate posturing. Okay, so here decerebrate. So we have our brain. So we have our cerebrum, medulla, whatever. So we have fibers going like this. Okay, so we have at cerebellum level decerebrate, at level of cerebrum decerebrate, and at level of cortex decorticate. So different level we can do the section. So this injury may happen, this will cause some features. Okay, so in decerebrate rigidity, you can see in the low, you can see decerebrate rigidity, you can see the posture. Okay, see how this hand is straight. Okay, so hand is straight here, straight 10 arms parallel to the body, and you can see flexed wrist and curled fingers. Okay, only that is the difference you can see here. Rest all are same. Okay, see, rest all are same. So in decerebrate rigidity, what happened? It is extensor rigidity. You can see the extension here, complete extension here. Okay, complete extension here. Corticospinal tract and the rubrospinal tract lesion. Okay, here it is very important. Why it is happening, I'll explain in the last. Okay, till that I'll just explain what is this. So extensor rigidity, corticospinal tract and rubrospinal tract both are having some lesion. Okay, so that's all. Okay, so that is why you can see this complete extensor, flexed wrist and curled fingers are there. This is decerebrate posturing. When it comes to decorticate posturing, you can see along with the curled wrist and hands, you can see here like this. Okay, here it is flexor rigidity. They are flexing, flexor rigidity. Hands are balled and against the chest. They are holding the hands like this. Okay, like this it is there. This is flexor. So what's happening here? Flexor rigidity, in the upper limb, because here the lesions in the corticospinal tract, not in the rubrospinal tract. Rubrospinal tract is intact. There is no problem for rubrospinal tract. Okay, that is why so this, so we have our cortex, cerebrum. Okay, so we have our cortex, we have this coming. So the rubrospinal tract, which is little lower. So in decorticate rigidity, rubrospinal tract don't getting any problem. It is intact. That's why rubrospinal pathway is intact and it causes flexor rigidity in the upper limb. If you want it, we have to discuss in detail upper motor neuron, lower motor neuron, what is that spinothalamic tract, what is dorsal column. We have to go little rubrospinal, tectospinal. So all these things we have to know. But just to understand this, rubrospinal tract is intact. Rubrospinal tract, that is red nucleus, it is having flexor activity. It causes flexion. So that just remember. So rubrospinal tract, which is intact in decorticate. Okay, this is decerebrate rigidity where both have lesion. That's why complete extensor. Here is flexor in the upper limb. That's all. Just understand this image. When the question comes, you can manage. So if it is red, it will be red nucleus, rubrospinal tract, it will be like this. If it is complete decerebrate, it will be extensor completely. Clear. So hypothalamic nuclei and function, very important. Direct question, 4 mark in your pocket. So you know pituitary gland is there. You can see the hypothalamus above. So you can see some kind of, these are the supraoptic nuclei. Okay, this is suprachiasmatic nuclei. So we have different nuclei are there. Mammillary body you can see. This is very important, and you should know at least few of them. It's very simple once you know some basic thing. We know physiology, hormone synthesis from pituitary. So it is easy. So you should know nothing but anterior is heat, and posterior is cold. Very important. Okay. So anterior is heat environment, function heat environment, response to heat, cooling. So this is very important. And posterior, cool environment, response to cold, heating. So function, this is very important. Anterior and posterior, heat and cold. This is very important. So this is very important. So anterior, heat environment, so response to heat, it will cool the body. Okay, and cold environment, response to cold, heat the body, posterior. So we can, so posterior, cold, anterior, heat, posterior, cold. Okay, so it is important. Okay, so we have lateral. In lateral side, we have something called feeding center, orexin. Lateral side, we have something called feeding center. And orexin, which is very important. Orexin we have discussed before also. The orexin, okay, which is important, which is for satiety center. So feeding center, orexin, that is in the lateral side. So lateral side, that is important. Okay, that is also important. Feeding center is there, or lateral. Ventromedial, we have satiety center. Okay, orexin, feeding center, and satiety center separately in ventromedial. These all have very related connection, and it's very important because we know satiety center is essential for food. Whenever eating food, we'll feel satiety. And feeding center, orexin was like awakeness. These are all very important. So this we discuss in some diseases and pathologies. Already discussed in some sleep cycle or some areas. Okay. So chiasmatic, nothing but circadian, circadian. So circadian rhythm, suprachiasmatic. This is the suprachiasmatic. So suprachiasmatic, circadian rhythm. Okay, supraoptic. You can see the supraoptic. Okay, you can see the supraoptic nucleus just above the, supraoptic, mainly ADH. We know that paraventricular oxytocin, supraoptic and paraventricular ADH and oxytocin, very important. Supraoptic, it is ADH, supraoptic nuclei, ADH, antidiuretic hormone, paraventricular oxytocin. And we have preoptic nucleus, ventrolateral preoptic nucleus is known as sleep center. And the mammillary bodies here, you can see the mammillary bodies here, nothing but our very important memory. Mammillary bodies are related to memory. So mammillary bodies, which M for memory, M for memory, and anterior for heat, posterior for cold, lateral for orexin. Okay, orexin feeding center, and ventromedial satiety center. Feeding center and satiety center both are very important in important hormone. There are drugs are coming in this. Okay, so this I'll refer and prepare for one another day. This is very important. Suprachiasmatic, chiasma, CHIA, circadian, and supraoptic areas, so paraventricular oxytocin. These are very important hormones. Okay, so mammillary bodies, it is going to memory also. So this is very important, and you should know you should write this into a 20th notebook. Write into this 20th notebook anterior, posterior, lateral, ventromedial, and you should know mammillary bodies for memory. So if you know this only, it is easy. Okay, if you know this much, it is easy. Make small mnemonic if possible, but you should know by heart. This is very important. Read it multiple times. Okay. Yeah, this is very important. Leukocyte function defect or leukocyte adhesion defects, these are very important. Okay, so what is this? Before that, we'll go and see the what happening. So we know what is chemotaxis, how leukocyte WBC is working in that. So we know margination, the leukocyte will go to the margins, then it will roll through the margins and it will get activated. So it will get activated, and there it will addition, it will adhere to the this one, and then it will go transmigration. So this is the pathway, this is the flowchart of our leukocyte extravasation. Okay, in the chemotaxis, this is very important. So in margination there are some connections, and in rolling you can see rolling. So you can see the p selectin coming and attaching and helping in rolling, and you can see the CD18 integrins, beta 2 integrins. These are active, these chemokines activate, and integrins so adhere to the integrin ligand ICAM 1. Okay, then PCAM is there, so that it facilitate diapedesis, that's changing in shape and it is going transmigration. So this is just briefly I told, this is little difficult, but you should know what's happening here. This is very important also. So what's happening? Margination, then rolling, activation, addition, tight addition, and transmigration. Transmigration changes of shape and going helped by PCAM, facilitate for diapedesis. So it will change shape and it is going inside. Tight addition by integrin adhere to integrin ligands like ICAM 1. Okay, this is PCAM. And activation by integrins CD18 and cytokines and endothelial P selectin is helping rolling. Okay, so this much you should know just for basic thing, but we don't want this for even in exam also. Okay, so we will see the individual defect and we'll come back to this slide again. Okay, so defect, the first disease is known as leukocyte adhesion deficiency. So leukocyte adhesion deficiency. So LAD1, okay, LAD1, leukocyte adhesion deficiency, it is what happening here. So it is defect in beta 2 integrin. Okay, it is defect in beta 2 integrin, leukocyte adhesion deficiency. Okay, because of this here, what happened? Recurrent infection and delayed suppression of umbilical cord. So delayed suppression of umbilical cord, this term will be there. It is lead to LAD1 because of beta 2 integrin, defect in beta 2 integrin. We will see in the next image. LAD2, 2. So LAD1, 1 for I, it is related to integrin, and it is important. And 2 is second, S for sialyl-Lewis X modified glycoprotein, related to Bombay blood group and recurrent infection will be there. So 2 is sialyl-Lewis X. Okay, and another one is chronic granulomatous disease because of defect in NADPH oxidase. This is very important. So this is an X-linked recessive, and okay. So X-linked recessive. Okay, and here recurrent infections, and you know catalase positive organism because of NADPH oxidase defect. This catalase positive organism causing recurrent infection. This is very important. They can ask this also. We will discuss this also. Okay. And Chediak-Higashi syndrome, the last one, Chediak-Higashi syndrome. Okay, Chediak Higashi syndrome. This is known as list defect. List defect. Okay, so we will see here what happened: fever, recurrent infection, albinism, white color, sensory neural hearing loss will be there. Okay, and thrombocytopenia will be there. So this is the summary of this leukocyte function defects. Okay, but now we'll go and see what's happening here. Okay, now see here. Now see here. So leukocyte addition deficiency. This we explained already. What is happening? We explained. Now we'll see rolling LAD2. See addition defect LAD1. Okay, LAD1. So integrin beta to integrin, for addition integrin is needed. Okay, and ICAM integrin which is needed. Okay, so LAD1 is addition defect. Here. So gene encoding beta to subunit. So CD18 beta to integrin defect. Okay, decreased or absent beta to integrin, and that will cause no addition. So that is happening in LAD1 because of beta to integrin addition defect. Okay, LAD2 is nothing but the rolling defect. LAD2 is second. Okay, 2 is second. So we have something called Siley-Lewis. Okay, that is deficient there. So Siley-Lewis X, that is modified glycoprotein. This glycoprotein, this is a gene encoding a specific GDP fucose transporter. So GDP fucose transporter, that integrins are normal here, mutation in this fucose transporter. So what happened? No functional selectin ligands. So here what happened? The selectin ligands are needed. So P-selectin, it is a no P-selectin. Here selectins are needed. Selectins problem. Okay, selectins are deficient. P-selectin, that is in rolling P-selectins are needed. Selectins are not there. That is why Siley-Lewis X modified glycoprotein, that is the defect that will cause rolling problem, and that is leading to LAD2. Okay, that's all. LAD3 is no needed. We leave it. LAD3, LAD1 and 2 is very important. LAD1 integration part, addition part problem, and LAD2 is nothing but rolling problem. Second, 2 selectin, P-selectin for rolling, which is important. Okay. Now we can see LAD1 beta to integrin, delayed separation of umbilical cord, that term will be there. LAD2, you can see 2 for S for Siley-Lewis and Bombay blood group also, that is related to the fucose transporter we described. Okay, LAD3 no need to study, is leave about that. Okay, so that is there. Now I discussed about something called some other disease also. So that is what chronic granulomatous diseases and Chediak Higashi diseases. This is very important. In chronic granulomatous diseases, you can see this is very important because here NADPH enzyme defect. Because of that, catalase positive organism will come and it will cause recurrent infection. This is an X-linked recessive or autosomal recessive also, but X-linked recessive you should remember. Okay, so there are some tests for NADPH, the hydrorhodamine test, DHR test, and nitroblue tetrasodium test are there. This is also very important. They can ask. Okay, this is there. So this is very important. Okay, so because impaired phagocytosis is due to neutrophil and macrophage defect in NADPH oxidase and superoxide radical production. So this is important. NADPH oxidase defect. Okay, this is important. NADPH oxidase defect. Okay, it is very important. That is chronic granulomatous disease. You can see there will be some granulomas in the necks and all, you can see, and lymphadenopathy will be there. It is very important. What is Chediak Higashi syndrome? I told list defect. List is nothing but lysosomal trafficking defect. Okay, so it's very important. So here what's happened, these are like functionless defects and worthless platelets. Thrombocytopenia will happen. So EC bleeding, bruising will happen. Okay, and because of this, some peripheral neuropathy, seizures, and some peripheral neuropathy will be there. That is very important. Recurrent infections. So granulocytes are useless. So it's like all functional defects. Chediak Higashi lysosomal trafficking defect. That's why list. So when you come to the summary, we discussed the summary here. You can see the summary. Leukocyte addition defect. LAD1 1,4-I integrin addition defect. Okay, and 2,4-S, it is selectin defect. Siley-Lewis X. Okay, defect. Okay, clear. And here delayed separation of umbilical cord, that term will be there. And chronic granulomatous diseases, we already told it is NADPH and catalase positive and NBT nitroblue tetrasodium test and all, DHR test and all I explained already. This is will become Chedia Kigashi lysosomal trafficking defect, lysosomal trafficking defect, everything non-functional. So platelet will come down, it will cause severe recurrent infections, and it will cause peripheral neuropathy, and sensory neural hearing loss and all will happen because of that. So that is also important. So this is a summary of leukocyte function defect. This is also very important. Okay. So this is very clear. Please watch this again. And last topic is alcohol withdrawal. Very, very important. We know alcohol, chronic alcoholic, they have some problems. So when suddenly they stop the alcohol, they have some withdrawal symptoms. So simple withdrawal and complex simple withdrawal seen within 12 to 14 hours. 12 to 24 hours within a day, tremors, tachycardia, increases sweating. So you will see in the casualty, people who drink well, suddenly they stop on the first day, second day, third day, they will come to the casualty with different features. They have night tremors will be there, rebound REM phenomenon will be there. So it is very important. On stopping alcohol, rebound REM will start. Okay. So this simple withdrawal within 12 to 24 hours, 12 to 24 hours it is there. When it is come to complex withdrawal, within 48 hours, 2 days, this GTCS will start. So seizure activity will start. So within 72 hours, it will start delirium tremens. This is very important. Within 72 hours, within 48 hours, GTCS will be there. Within 72 hours, on the second day or third day, we'll say on the third day, they will come with delirium tremens. Day 2 ke baad, DT, day 2 ke baad. So day 2, at the end of the day 2, within 72 hours, they'll come with the delirium tremens. So this is the having prominent visual hallucination. Okay, Lilliputian hallucination, seeing everything small. You know, Lilliput, Gulliver's Travels. Lilliput is nothing but is feeling like small. Okay, feeling small, tiny objects. Okay, and altered sensorium tremors. This is known as delirium tremens on the day 2 k baad, that is within 40 hours to 72, less than 72 hours. This is very important. So simple withdrawal, complex withdrawal. So the treatment for this is drug of choice for alcohol withdrawal tremors and all is benzodiazepine. And already liver, because of alcoholic, liver is already damaged, so we are giving some benzodiazepine causing problem to liver. It is again dangerous, so we have to give safe in liver function. So benzodiazepine safe in liver function known as lorazepam, oxazepam and temazepam. We have to give this rank lot liver safe. So liver we have to save the liver. Already liver is in some damage, we have to save the liver. Lot should be given lorazepam, oxazepam and temazepam. Okay, and alcohol related psychosis is the very important. Delirium already we discussed. Okay, and alcoholic hallucinations. So even though Lilliputian hallucination, the most common hallucination is auditory hallucination. Okay, and we have Korsakoff psychosis. Okay, chronic confabulation and anterograde amnesia. This is important. This is anterograde amnesia, not retrograde amnesia. Okay, this is very important. Clear. So in Korsakoff psychosis, mammillary nuclei and anterior thalamic nuclei are involved. It is getting affected. This is also very important. Okay, so other than Korsakoff psychosis, we can see something called Wernicke's encephalopathy with GOA, global confusion, ophthalmoplegia and ataxia. The triad is known as GOA, global confusion, ophthalmoplegia and ataxia. Okay, so this is an acute condition. Here petechial hemorrhage in mammillary body and periaqueductal gray matter areas are seen. Okay, this triad is known as GOA, global confusion, ophthalmoplegia and ataxia. This is also important. So I gave some another mnemonic. If you want to remember, you can remember like this also, but this is only sufficient. Okay, so anterograde amnesia. So alcoholic anterograde amnesia, that is very important. And they have auditory hallucination, which is most common other than visual hallucination. So A, this is very important in alcoholic. Okay, clear. So yeah, we have some aversive therapy. As we know it is disulfiram, irreversible aldehyde dehydrogenase inhibitor. So aldehyde dehydrogenase inhibitor, aldehyde acetaldehyde, it is very toxic. It will cause this flushing, vomiting and all. So irreversible aldehyde dehydrogenase inhibitor is disulfiram. This is very important, and it increases the level of aldehyde, serotonin, dopamine, and histamine. That's why flushing, all this vomiting problem. So those in aversion therapy, they are afraid to take alcohol and will stop. So if it is taken with alcohol, it causes disulfiram ethanol reaction and it is dangerous. So minimum 12 to 24 hours after stopping alcohol only they have to take. So immediately stop and within 1 hour you started, it is disulfiram ethanol reaction. So minimum 1 day gap should be the 12 to 24 hours after stopping alcohol only we can start this disulfiram. That is also very important. So it is avoided in peripheral neuropathy and psychosis. We cannot give this drug in peripheral neuropathy and psychosis. Okay, that is also very important. So disulfiram, how to use it also very important. And we have anti-craving drugs for nicotine cessation. Nicotine cessation, that is important. Nicotine cessation, that is very important. We have varenicline and the bupropion. Varenicline is the alpha 4 beta 2 partial agonist known as varenicline. Okay, varenicline. Okay, this is the best drug. Okay, but you have to avoid in neuropsychiatric symptoms. We have to avoid this varenicline alpha 4 beta 2. This is very important. And bupropion also we can use. So anti-craving drugs for alcohol cessation, we can use some alcohol cessation. Acamprosate, naltrexone, topiramate, SSRI, ondansetron, and baclofen. This can be used for alcohol cessation also. So this anti-craving drugs for nicotine cessation is very important. Disulfiram, how to use. The mechanism of disulfiram also important. It is an irreversible aldehyde dehydrogenase inhibitor. That is very important. We should know alcohol related psychosis regularly. They are asking Wernicke-Korsakoff syndromes, very important. Okay, so and we should know the acute and simple withdrawal and complex, and what is delirium tremens. They already asked and they will ask, and lot tricks also you should know. And this leukocyte addition defects I explained, and just to know these 4 cases, put in your note, and definitely if a question come, you are going to get a 4 mark, I'm sure. Hypothalamic nuclei is also very important. You should learn some point in your write in your 20 notebook. Decerebrate and decorticate rigidity also very important. Yeah, all over this community medicine topic, this is very essential, very important. You should know the disability indicator, DALI, COLI, Haley, and these indexes, indicators. These are very important. Okay, today we discussed a very highly important topic. Even the topics are very small. This is very, very important. Okay, you should know this point. Without this, there is no NEET exam. You at least learn this, make it to your 20th notebook, revise it multiple times. These are very important. So I completed 14 day. Still I have to go 16 day, and NEET is having only 14 days remaining. So I have to do something called 2 days special. So what I am planning is, I am planning something called medicine session. So it is very difficult to study medicine. So I will be starting classes for cardiology. So I'll finish cardiology in 1.5 hours. I'll finish nephro in 1 hour and 1 hour. So 1 hour like that sessions I will do, and some pharmacology, very, very important. So I'll be going in mostly in live video. I will keep a timing. I'll update the timing. So just if you go on live, the classes will be there along with me. I'll open my note. I'll show the important point to see, remember. I will send the PDF, upload the PDF in Google Drive. You see the PDF, you see my class, and go forward, and we'll finish it fast. This is not a standard way, but this is the only possible way in the last time to do these subjects. So I'll be doing medicine, pharmacology, little microbiology, and later if needed some subject also I will do. This is the possible time, 14 days remaining. How I can do everything, I'm trying my best to help. Okay, please revise. Only 2 weeks are remaining for your exam. Only 2 weeks are remaining for your exam. Revise maximum, do PYQ. If you want to skip some subject, no problem. Just see the PYT, do the PYQ of just 2 to 3 years. That's enough. Okay, thank you so much.